Hello and welcome to another episode of The Drugs Guy, Medication Made Simple. In this episode, we're going to be talking about gastro-oesophageal reflux disease, also known as GORD. Some definitions to start with. GORD is a chronic condition where there's reflux of gastric contents back into the esophagus. It causes symptoms of heartburn and acid reflux. Dyspepsia is the complex of upper GI tract symptoms which are present for 4 or more weeks, including abdominal pain, heartburn, reflux, nausea and vomiting. So GORD is the condition and dyspepsia is the term for the symptoms associated with it. What are some risk factors? So as usual, smoking and alcohol, stress and anxiety, obesity, age, having a positive family history, fatty foods as these delay gastric emptying, coffee and chocolate as these reduce lower esophageal sphincter tone, hiatus hernia as this lowers esophageal sphincter tone, and pregnancy due to hormonal changes which are thought to decrease the lower esophageal sphincter pressure. A little bit of anatomy about the lower esophageal sphincter. So it's a ring of muscle at the point where the esophagus meets the stomach, and it's there to protect the esophagus from acidic stomach secretion. Looking at the figure, in the top image we can see the esophageal sphincters closed, and in the bottom image we can see the esophageal sphincters open, which allows stomach contents into the esophagus, causing heartburn. How common is it, and what are the complications? So it's relatively common, but it's difficult to pinpoint a number on it due to underreporting. Some studies estimate that about 40% of adults will experience symptoms once a year. Complications can include esophageal ulcers, Barrett's esophagus, and oral problems such as dental erosions, gingivitis, and halitosis, which is just a fancy word for bad breath. What are some red flags to look out for? The first would be dysphagia, which is a fancy word for difficulty swallowing, a loss of appetite or weight loss, any vomiting, abdominal distension or tenderness, any blood in the stool, if they're over 55 and have new onset, or if it's treatment resistant. These may indicate a GP referral who can then do further testing. So how do we manage it? Lifestyle measures are first, including over-the-counter treatment. We'd then try a full dose PPI for 4 weeks. We'd then maybe double that dose for another 4 weeks. And finally, we could add a H2 receptor antagonist. It's important to mention that PPIs should be used at the lowest effective dose and for the shortest duration possible when treating GORD. So what are some lifestyle measures we can introduce? Stopping smoking, reducing alcohol consumption, losing weight if appropriate, avoiding trigger foods, and eating smaller meals and not eating before bed. So this means having the last meal of the day at least 4 hours before sleeping. Also a practical tip would be to prop up the head with more pillows at night. Moving on to antacids, there are lots of different products available and they have lots of different ingredients, but they all work in a similar way and have similar properties. I'll focus on the most commonly seen. So to begin with, we'll talk about Gaviscon, which contains potassium bicarbonate, sodium alginate, and other ingredients, but these are the most common. It's available as a general sales list medication, meaning you can buy it from anywhere. It comes as sachets, liquid suspensions, and chewable tablets, and it works by reacting with gastric acid to form a pH-neutral raft of alginic acid gel, which floats on the top of the stomach contents, protecting the esophagus. It's high in sodium, which is important to note for those on a reduced salt diet. It's high in calcium, and it also contains benzyl alcohol, which is found in some preparations. This can accumulate in those with liver or kidney disease and cause issues. It's important to take it 2 hours before or after other medications, as it can interact. Another antacid is Pepto-Bismol with the active ingredient bismuth subsalicylate, and this is a pharmacy-only medication. It's available as an oral suspension or a chewable tablet, and it has weak antacid properties. It's more useful for stomach upset. There's an association between salicylates and Ray's syndrome, so avoid it in under 16s. Also don't take it with aspirin, and it's not to be used in gout because it can cause a flare-up. An interesting side effect is that it can cause black stools and a black tongue. These are both harmless. Avoid it with anticoagulants or tetracyclines, take it 2 hours after, and there's a photo of the black tongue. Moving on to Rennies. These contain alginic acid, but the main ingredient would be calcium carbonate. They're available as a chewable tablet or an oral suspension, and they're a basic compound, so they simply neutralise the acid. They shouldn't be used in severe renal insufficiency, and also don't take them with large amount of milk or dairy, as this can cause something called milk alkali syndrome. There are some side effects, and again, take 2 hours before or after other medications. Other drugs, we have something called simethicone, which is available to purchase from anywhere, and this is often found as an ingredient in other products, or on its own is available as oral drops or a suspension. And this is a surfactant. It decreases the surface tension of gas bubbles, making it easier to pass wind, and it's used for colic or trapped wind. It carries the warning of less suitable for prescribing, as it has uncertain evidence. It interacts with levothyroxine, so don't give concurrently. Moving on to PPIs, such as omeprazole and lansoprazole, these are prescription-only medications for the most part, and they're available in a variety of forms. They work by binding to the proton pump, which is a H plus K plus ATPase in the parietal cells of the stomach. By doing this, it reduces the amount of hydrogen ions entering the stomach, therefore reducing the amount of hydrochloric acid and lowering acidity. Referring to the diagram, here we see the PPIs on the right, binding and blocking the H plus K plus ATPase, therefore reducing the amount of hydrogen ions being pumped through it into the stomach. There are many issues with PPIs, one being they can cause hypermagnesia, another being an increased risk of hip, wrist and spine fractures, especially if used for high doses in the elderly. They increase the risk of GI infections such as C. diff, amongst others. They reduce the absorption of vitamin B12, and there is MHRA advice regarding the low risk of subacute cutaneous lupus erythematosus, which is drug-induced and it can occur weeks, months, or even years after use. Side effects are they can cause constipation and diarrhea. The interaction of note is the interaction between clopidogrel and omeprazole. This is one that's commonly seen. Over the counter, we can buy Nexium Control, which is esomeprazole, but it's available for 2 weeks only. That's what it looks like. Moving on to H2 receptor antagonists, such as ranitidine and famotidine. These are prescription-only medications for the most part. They come as tablets, solutions or injections, and they inhibit the H2 receptor in gastric parietal cells. Referring back to the same figure as before, we're now looking at the top left of the image. The H2 receptor antagonist binds to the receptor, stopping this from working, therefore stopping hydrogen ions being pumped out into the stomach again. They slightly increase the risk of pneumonia, however this is only slightly. Other than that, there's minimal side effects and minimal interactions. You can buy ranitidine over the counter, however it's for a maximum of 2 weeks of supply. That's what the box looks like. However, it's important to note that at the minute, ranitidine products are currently not available due to concerns regarding contamination of products with a carcinogen, so you can't buy it or prescribe it at the minute. That's everything. Thanks for listening. Please like and subscribe for more of the same content.